my biggest fear was dying. 53, you know, I'm physically fit. I don't feel sick. I'm able-bodied, you know what I mean? Now I'm looking at, I'm getting ready to die, you know? I didn't want that. My name is Leroy Blackwell. I was diagnosed with stage 2 prostate cancer in the 7 stages to the procedure. Well, basically, I didn't have any physical symptoms, you know, what I done heard so far, what everybody else tells me, their symptoms, stuff like that. I didn't have any of that, you know? I still felt 100%. It just took a toll on me just to know that I had it, you know?
Prostate cancer is silent when it first begins developing. If it develops to the point where it blocks the urinary tract or spreads to other parts of the body, then of course the prognosis is much worse. The only real way to find it early is for routine screening, and if the PSA is rising from one determination to the next, that's how you will find it early. It definitely don't want to wait until it becomes symptomatic. PSA is prostate-specific antigen, and it is a protein that is made by prostate cancer cells. Typically, it's found in very low amounts. As the cancer cells multiply and accumulate within the prostate, then the PSA is gradually going up higher and higher. And that will be an indication that the prostate should be biopsied and to determine exactly what the situation is.
Prostate cancer is one of the second leading cancerous death in men. This kind of awareness month is necessary so that patient can come and, get checked up, or annual screening can be done so that we don't diagnose something at the late stage which will be difficult to treat. Prostate cancer screening has been controversial over the period of time. Different associations recommend different age group for the prostate cancer screening. We follow American Urology Association guidelines, or we call AUA. So usually for prostate cancer screening, we look at the low risk, medium risk, and the high risk. However, it's all depends upon the shared decision and the risk factors. So risk factors, if you have a strong family history of a prostate cancer, and African American men, they do have risk factors of getting prostate cancer compared to other men as well.
I never had any issues with cancer, but we had cancer in our family. I went to see my doctor for my regular checkup, and she did some blood work, and she told me my PSA was a little high. After that, she sent me over to my oncologist, and he did my biopsy, and that's when I was diagnosed. Before I knew what stage 2 was and where I was at with it, I was thinking about doing robotic surgery. I called Miss Murray, and she said, well, come on in and talk to one of my doctors that we used, Dr. Laser. I did some tests with him. And he said, hey, Ms. Blackwell, you might not need to do robotic surgery. Would you like to try radiation?
Here at Riverside, we have several ways that we can treat patients with radiation. The two most common ways are with IMRT, which we can use for both very early disease and some that's a little bit further progressed. We also have stereotactic radiosurgery, which is better for disease that's caught earlier, where the prostate is smaller and not having escaped from the gland. It's a very precise treatment, and it requires fewer treatments than the IMRT. Some patients prefer radiation to surgery because it's much less likely to cause impotence or incontinence, which is inability to control the flow of urine. But we like to give patients a choice, and Mr. Blackwell was given a choice. He chose to be treated with the IMRT. His chance of this tumor coming back is only in the range of 10 or 15%.
Basically, doing my treatment, I was able to work every day. There was no issue, no problem. I basically stayed my faith and stayed strong, and that kept me a long way. And usually cancer, if you don't catch it early, it's more like a death sentence. So every man should go out, definitely get checked, no matter what. I think every man and anybody who has cancer should come to Riverside, because they are like family to you, and they treat you like family. And that's what I loved about them, and they was bonded with me from day one.